good afternoon, everyone. Merry Christmas and happy holidays. I'm happy to be speaking to you today about a topic that you may have heard a little bit about called COVID-19 or coronavirus. And I say that jokingly. Obviously, this has consumed a large portion of our lives in 2020. And so today, what I want to accomplish is simply give you a non-political, very practical, very scientific understanding of a virus, what the virus does, specifically COVID-19, what the statistics look like, and really a very logical approach to what we're seeing in this community. So hopefully by now you can see my shared screen with my presentation on it. There it is, and we'll jump right in to the talk. Let's see. Having trouble advancing here. One second. So when we talk about a virus, it's very important to say, well, what is a virus? It's a submicroscopic infectious agent that replicates only inside of living cells of another organism. So a virus in and of itself does not have the ability to live really without a living organism and the help of that living organism. It can live outside of the body for a short period of time, but if it doesn't get that host, then ultimately it will die. There are a lot of commonly known viruses in the world. Some of those listed you can see in the presentation include influenza, HIV, herpes, rhinovirus or the adenovirus are two common viruses that cause the common cold. Rabies is a virus, chickenpox and smallpox. And these are just to give you an idea that viruses are very readily around us and affect us on a regular basis. The issue that we have with the coronavirus or the COVID virus is it's brand new. It's never been in humans before. It has been in animals, but as of this year, it has made its way to infect humans. And of course, that poses a lot of problems, namely that the entire human race on the planet has never been exposed to this virus in essence. Therefore, they don't have any kind of immunity or immune response to being affected by it. And hence the reason we're in the predicament we're in with a pandemic. A lot of times you'll hear the word mutation thrown around when they're talking about the virus. And then virus can undergo these subtle genetic changes through something called mutation. Now, the concern is there's two types of viruses. We have DNA viruses and RNA viruses. And I know when I say those two things, it kind of brings you back to high school science class when you talk about DNA and the double helix and RNA and the single helix. A DNA virus is a virus that has a lot of difficulty in its duplication because of the checks and balances that exist between the two strands of genetic material. Meaning if one of the strands tries to mutate and is slightly off, the other strand usually corrects that mutation and prevents it from happening. This is different when we have RNA viruses because RNA viruses, if you'll remember from your science class, is really only a single strand of genetic material. There is not that checks and balance system, and therefore RNA viruses can mutate much more rapidly. And we see this commonly in the RNA virus called influenza. And that's why you get a flu shot annually, is because this is a virus that is known to mutate very frequently, and it does so because it's an RNA virus. Coronavirus is an RNA virus. But there is a belief out there that exists that this virus basically became infectious in humans, but it was man-made. It was not done so through a mutation that occurred through nature. And because of this, the belief is that even though it's an RNA virus, the fact that it will mutate may not occur as rapidly as something like influenza. And when I say that is what we're talking about now. There's certainly in the future, this RNA virus can have the potential to rapidly mutate, but we're just not seeing that yet, as of yet, with the virus. So the next thing I'd like to talk about is really look at the numbers. And so right now, or even from the beginning of the pandemic, you've heard us oftentimes say, well, how many cases of the virus do we have? And then how many people need to be hospitalized? How many people live in need to be admitted to the ICU, be put on a ventilator, and then how many people die. These are all very important numbers, and they're very important really specifically when the pandemic began in the early part of 2020. And they were specifically important because when we look at the number of positive cases compared to the number of people that die, what you're essentially trying to establish is how virulent or how bad is this infection going to be. Meaning, on one end of the spectrum, it could be incredibly virulent, meaning it kills a bunch of people, and we get worried about the number of people getting infected and the number of people dying. On the other end of the spectrum is a lot of people get it, but very few people die as a result of it, meaning it has low virulence. And what we were able to prove really in the spring of 2020 was that this is a virus that offers very low virulence, meaning that even though a large number of people become positive with the virus, very few people ultimately end up dying as a result of it. And certainly we all say that, one death is too many. But in the natural course of a disease process, there are going to be people that get the virus and die as a result of getting that virus. So the reason I lay this out for you is here we are some 9-10 months after the beginning of the pandemic in the United States, and we're still counting positive cases, which is okay to do. But I want you to understand that the relevance of knowing the number of positive cases at this point in the pandemic is much less than it was in the springtime, because essentially you can extrapolate that the number of people that are going to get the virus is the number of people who don't have any immunity to it, and the number of people that don't have any immunity to it is everybody in the planet. So there is the potential for everyone on the planet to get a virus because they have no immunity. So if you want to look at that in terms of East Baton Rouge Parish, we have about 460,000 people in our population, which means that everybody is vulnerable to catching the virus. But contrary to that, what we know is that only 0.1% of the population has resulted in getting the virus and dying. So you have basically a 99.9% chance of survivability when it comes to being infected with it. The other piece to this is to understand that in all the investigations I've done regarding the COVID-19 infection and virus, 100% of the people who have died as a result of the virus have had comorbidities. And in a future slide, we're going to go through looking at what those comorbidities are, and so we can grasp and understand that. The last part and the most important part of this slide is I did a quick age breakdown so everybody could see what those mortality numbers look like. And what I want to point out is specifically, if you look basically our grade school, our high school, and our college age people basically have a 0% mortality when it comes to this virus. It really affects people that are older in age, and you can see that as if 70 and older, those individuals have been most impacted by the virus when it comes to death. So this is a graph and a representation of the number of people that died daily starting back in March. And as you can see, that curve drove up pretty high, where we were getting somewhere between 7 and 12 people per day dying of the virus in April. And that really was the spike that really not only was seen in East Baton Rouge Parish, but also in Louisiana, also around the country. After that, we talked a lot about, if you'll remember in the springtime, flattening the curve. And those were the mitigation measures through the quarantine that were put into place to drive those numbers down. And they worked. As you can see, we went down to having 1 or 2 deaths per day. And then in the late summer and early part of fall, we got to an area where we really were having one death every couple of days. I think the longest time span we went was 6 days between people dying as a result of the virus. Now those numbers have crept up, but they've only crept up very slightly back to the 1 to 2 people per day dying from the virus. We have not seen a spike like we did in the spring, in the April timeframe. And so I would not say we have a resurgence of death spiking in the fall. Basically, it's still maintaining kind of that flat trajectory that we saw once we flattened the curve. So as I mentioned earlier, we talked about comorbidities. And what I've listed here for you on the screen are the comorbidities that we see associated with people that die as a result of COVID-19. Obesity, morbid obesity, diabetes, hypertension, any kind of pulmonary disease like chronic obstructive pulmonary disease, asthma, pulmonary fibrosis, and age. Now, I was recently giving this talk, and somebody was excited because I actually included age on there, but it was the last one. So their assumption was, well, maybe that's not as important. The reason I put age last of the comorbidities is because out of all the ones that are listed there, it's the only one that you or I can do nothing about. Our age is chronologically what it is, and that's just a fact. So as we get older, we put ourselves in a more susceptible environment for a bad outcome if we contract COVID-19. Of course, all the other ones, there are preventatives such as medications or healthy diet and exercise that can prevent having some of those disease processes. And I think just on an anecdotal or personal basis, you noticed a lot during quarantine, people took that seriously and started to be healthier now that they were stuck at home. I know I have friends that sell bicycles in town, and people were out biking and walking and doing things that were more outdoor activities rather than what had been our lifestyle of sitting at a desk all day and probably having some pretty poor dietary habits as a result of it. But I can tell you this with 100% certainty that all the deaths, and we're now a little bit over 500 deaths in the parish, have had these comorbidities present in the person when they died as a result of the virus. So let's talk a little bit quickly about immunology, and I think this is very important for us to understand because we're really right on the beginning of a vaccine becoming available. I know that it has started to be distributed here in Louisiana. There are people that have gotten their vaccination. My vaccination, because I'm considered a first responder, will be on Friday, and I will be taking the vaccination, and I'll get into that in just a second. But the two things in this slide I want you to consider is the fact that you have two types of way to create immunity. One is naturally having immunity. The other one is artificially. And when we say naturally, that's when you get a disease process, you get COVID-19, your body fights it off, its own immune system, and it develops active immunity as a result of that. This by far is the absolute best immunity you can get. Of course, the risk is you have to survive the infection to get it. Alternatively, we have artificial immunity that results as far as getting a vaccine. You get a vaccine that has been FDA approved and is safe. And ultimately, what that vaccine does is allows your body to develop that immunity so that it can protect itself against the virus. And that's what we're seeing with the advent of the virus and now the distribution of it here recently. Just to put it in perspective as numbers, active immunity being really good would be more like in the 99 percentile as far as immunity goes. Passive immunity, as far as the studies have shown with the COVID-19 vaccination, is 95% effective. So both of those scenarios put you in a really good position for protecting yourself against the virus. Nothing in life would be 100% in this scenario. There's still always the chance, whether a small chance, that you could still get the virus in either scenario. Another quick slide about the immune system. I want to point out, if you look on the slide, we see these things called helper T cells. These are it's a picture of a lot of blood cells that exist in the body, but the helper Ts are really, the memory Ts are really important because these are the ones in our body that remember the infection, whether that is artificially created through vaccination or actively created through getting the infection. It's the part of our system that remembers it and holds on to it for future infections. It's still not known at this point what the extent of that's going to be, simply because it's too early to know. How long will your body remember its immunity? It will likely remember it for a very long time, but will it hold on at high levels in the 90 percentile range, or maybe the 50 percentile range, or maybe the 40 percentile range. We don't know yet. And we don't know yet just simply because not enough time has passed for this to be studied and understood. But I can assure you that this is one of the things that scientists are looking at to see how long this immunity is going to last, because that will tell us how often we need to be vaccinated. If it'll be like flu where you need a vaccination once a year, or if it will be like something like pediatric immunizations where you get one and then maybe you get a booster later on. Tetanus comes to mind. You usually get a tetanus booster every 10 years, meaning your body can establish immunity for a 10-year cycle before it needs to be reintroduced to the infection through immunization to kind of get ready for the next time it may or may not happen. So lastly, I want to go over what I call myths and facts. In this slide, I've listed a few things that I think we've all heard very repetitively throughout this pandemic, mostly through media outlets and sources. But the first one is scientific experts, right? You hear people all across the world talking about, well, the scientific experts. I think it's important for us to understand when we talk about the term scientific experts, every physician, clinician, scientist on planet Earth has known about human coronavirus for about a year. Nobody has known or studied it any more than that. And so when we say scientific experts, we're talking about people who are very smart, but really have only had the same amount of exposure to the virus, how the virus acts, how to treat the virus, and all these statistics. So in some essence, that term gets overused, in my opinion, as opposed to saying that people are applying logical, practical, scientific methods rather than being experts. I would give you the example that, somebody who's been in a laboratory studying Ebola for the last 20 years would be considered a scientific expert on Ebola because that's a virus that they've known about and they've been looking at the nuances of. They should certainly be considered a scientific expert. Most of the people we're talking about are people that are looking at this new novel virus from an angle of science and applying what should be considered practical and knowledgeable scientific evidence as far as we're capturing it, understanding this new virus. The second myth versus facts is the mask. Certainly, there's a lot of controversy over whether you should wear a mask or you shouldn't wear a mask. So because coronavirus or COVID-19 is a respiratory illness, which means that you have to transmit it through the presence of respiratory droplets, any kind of physical barrier between you and another individual to avoid that respiratory transmission will prevent the spread. However, if you truly wanted to look at the size of the virus and the appropriate mask, there's a mask called an N95, which is the most sophisticated mask we really have, that would absolutely be responsible for preventing the spread. A lot of the face coverings we have now certainly give you maybe a little bit of false sense of security in the sense that they can prevent it, but it's not 100%. Certainly the respiratory particles that coronavirus being so small and microscopic can get through those masks. So I say, it's important to mask, but it's important to mask in the appropriate situation, or maybe consider the synergistic effects of the second myth versus facts, which is social distancing. Now, we've all heard the number 6 feet. That really is an arbitrary number. It doesn't mean that coronavirus can only travel 5 feet 11 inches and will not go any further. And then at 6'1", it stops, or whatever the case may be. The point is that if you find yourself in a situation where you can socially distance, meaning you can separate yourself from another individual, then you're likely to improve your chances of not catching the virus. If you add masking to that, then of course it's synergistic. You are increasing your chances of not getting the virus. None of these are foolproof. Another one would be contact precautions, the ability of what you touch. You touch your mouth and then you touch something else, it can be transmitted. Surfaces and survivability is another myth versus fact. And what's important to understand there is that if you recall in the springtime, the CDC came out and they said, oh, this thing can live on surfaces for 2 weeks. And so we were scrubbing everything down. And then a short time later, they said, well, it's really more like 10 days. And then a short time later, they said 7. And now we're, I think, at 3 or 4. And so the point is as the pandemic goes along, we learn more and more about the virus and how it can survive on surfaces. I would like to wrap up all those, the masks, the social distancing, contact precautions, and surfaces into the following things. We should just really protect what would be kind and reasonable and logical approaches to how we insulate ourselves from being exposed. So if you can socially distance, do so. If you find yourself in an environment where you can't socially distance, protect yourself with a mask. Be careful of the things you touch, especially if it's like a public water fountain, you should wash your hands. Or maybe not even use the public water fountain. So you should consider all these things together and use them in an appropriate fashion and method. Another myth and fact versus fact that I get oftentimes is that people says, well, every death is considered a COVID death. So as the coroner of East Baton Rouge Parish, I'm in charge with determining the cause and manner of someone's death. And one of the specific things that I'm in charge of investigating is any death that is a result of a virulent contagious disease or poses a risk to the public's health. COVID is exactly in that criteria. So I investigate every single death related to COVID in this parish. In doing so, I adopted some very strict criteria at the very beginning to say this is a COVID death, and this is the criteria. First and foremost, you have to have the presentation of a respiratory illness because COVID is a respiratory illness. You have to have cough, you have to have congestion, fever, shortness of breath, low oxygen levels, or hypoxia. Secondly, you have to have a positive screen. So meaning we have to swab you and we have to know that there is COVID found in your system. And lastly, you have to die as a result of your respiratory illness. So meaning if you have number 1 and number 2, and then you're involved in a motor vehicle crash and die as a result of that, that is not a COVID death. I can assure you that the 500, a little more than 500 deaths that we have had in East Baton Rouge Parish have met that criteria, very strict criteria. I can also say that probably in the state of Louisiana, because I know most of the coroners in the state, they're adhering to similar policies in defining these cases. And so I would opine that the death numbers for the state of Louisiana are fairly accurate in essence because we follow these very strict criteria. COVID follows a very pathognomonic presentation, clinical presentation. Typically, the person gets the virus leads to pneumonia, and the pneumonia leads to acute respiratory distress syndrome, or ARDS. So that really is what becomes the official cause of someone's death, as you can see listed on the slide. Next, I will talk about 2 other myths or facts. One is shedding and one is carrier state. These have been really laid out by the media and in other entities. They're scary words. I think sometimes when people hear the word shedding, they feel like someone's walking down the street and COVID-19 virus is just falling off their body everywhere. I'll remind you what we said in slide 1, which is the virus cannot live very long outside the body. As a matter of fact, if it is trying to transmit, it will transmit through the respiratory mechanism, and it will be looking for another host. So shedding is a phenomenon that can occur in virology with viruses, but it's a very rare phenomenon. I don't want you to go away from here thinking that everybody in the world is shedding the virus, because that's just not the case. The second term that gets thrown around a lot is the term carrier state. Again, another scary term because you have this impression that there's an individual who's a carrier, but you can't recognize them because they're in disguise and they are infiltrating your safe bubble and they're carrying the virus into you. Carrier state is something we commonly see in virology with all viruses, but it's a very rare phenomenon. Most likely, what people have defined as carrier state, when you've heard it, are people that actually have very mild, almost unrecognizable symptoms. However, they're still symptomatic. And that, to me, has really been one of the major issues, is if you don't have any symptoms or don't recognize your symptoms, and you're not coughing, you're not sharing respiratory droplets, you're not eating or drinking after someone, it becomes very difficult to transmit the virus if you don't use a transmission mechanism. Unfortunately, this term carrier state has come out. And so now people get concerned that if they're in close proximity with someone who doesn't have symptoms, they could be carrying it and they could easily transmit it to them. And I want you to believe it's not that simple of a process. As a matter of fact, carrier state is very rare. More than likely, what we have in our community are people that have severe symptoms, and those are easy to tell. People that have moderate symptoms, and those are easy to tell as well. The tough ones are the ones that have mild symptoms. And those are people that usually have a pretty robust immune system. They're young, they're healthy, and they may not even recognize their symptomatology because it is so mild. And so those are the ones that we should be cautious about, but they're not traditionally carriers. They actually have the virus. It's just they have mild symptoms of the virus. So those are some myths and facts that I hope I laid out for you today to really kind of get a grasp and understand some of these concepts that you've probably heard about over the last year. So in closing, and then I think we're going to have some times for questions, is the thing I want to leave you with is I think we're actually in a really good state right now. Even though we're seeing the rise of cases, we're seeing lower hospital numbers, lower ICU and ventilator numbers, and the death numbers have really maintained at a low level. Now, certainly, we don't want anybody to die from this process, and that's why it's so important to consider the vaccine. But you know, if like I said earlier, and the reason I'm getting the vaccine, I've never had COVID, even though I've probably been exposed a lot. I am going to get the vaccine because I want to protect myself, and I think it's important to do so. And so you have to, you know, kind of weigh that cloak of protection that you put around you, like a police officer wearing a bulletproof vest. It's not foolproof, but nonetheless, at the end of the day, it will provide you some protection. And especially if you're vulnerable, you have a comorbidity that can put you at an increased risk. Those people probably should really consider getting the vaccine as they move forward. So I appreciate your time today, and I certainly welcome any questions. Thank you.
Well, that was awesome. I learned a lot there, and I hope that a lot of people picked up on some of the differences and with the myths and the facts. Greg Wolverton asked, hypertension is listed as a comorbidity. Does that apply to everyone with hypertension, even if that person's hypertension is under control with medication?
Yes. And so the answer is simply yes, it does. It's good that it's under control with medication, because certainly there's a lot of other bad things that can happen if your high blood pressure gets out of control, even worse than COVID, like heart attack, stroke, and kidney failure. But nonetheless, the specific receptor that is affected in the lung by the COVID virus is ironically a receptor that deals with hypertension. The two receptors are the same. So it does still put you at some risk, even though you're a controlled hypertensive patient.
Daryl Adams asked, he was on the one slide that was listing the myths. Were all of those things myths, or were you just trying to break down the difference between the two?
Yeah, I was trying to break down the difference into two. So you might have heard a word like carrier state, and I wanted to define what a carrier state is so that people didn't think that there were carriers just everywhere you went. And so it was basically a compare and contrast slide to give you idea and information about both of those things.
So I have the KN95 mask versus the N95. What is the difference between the KN95 and the N95s?
I'm not sure, but it sounds like they're probably pretty close. I mean, what you're talking about is a mesh structure that can handle the smallest of particles. Okay. And so the N95, and that's a measurement, the 95 is a measurement of microns, is really the kind that we use in the hospital when we know we have an active COVID patient in front of us. If we don't know that they're actively COVID, we will wear just a regular mask, much like you see, you know, surgical mask, whatnot on the street.
Okay, and Nancy Stitch asks, what behaviors are the most risky for the general population?
So I think this is a really interesting thing because in the past, prior to COVID-19, all of us would have a cold or something. And if we didn't feel too bad, what would we do? We'd go to work, we'd push through it, right? And we're really in a position now where we're going to have to change our mindset, because if that illness that you have is one of the many other illnesses that we've been affected as a human race before, no big deal. Most of the people you'll be around will already have had it and have some form of immunity to it. What's important now, though, is if it's COVID, it can be easily transmitted to someone else. And so we have to really change our mindset when it comes to being sick and being around others, and not and taking those precautions. And really, honestly, it's kind of the nice thing to do for your fellow man or woman is to not go be sick around them, right? I mean, you wouldn't want to cough in someone's face. That just wouldn't be polite. So we really have to take those behaviors into consideration when it comes to protecting fellow people, especially people with risks.
Beau, that looks like kind of wrapped up the questions there. Any closing you want to go with?
No, I just hope everybody has a happy and safe holiday, enjoying the time that they can spend with their families. And certainly remember there are folks out there that are taking their isolation, their precaution, their social distancing, and just check on them, make sure they're okay, because with social distancing comes social isolation, and that's not good for humans either. It's probably worse than COVID, honestly. So make sure you check on those folks.
We did get one last question here. Is there a list of criteria Louisiana coroners are using to determine a COVID death? Is that publicly available?
So the list, there's not an official list for criteria. I gave you the one that I use, and I think most coroners have adopted that, looking at it from the sense of what's the presentation clinically, meaning it's a respiratory presentation. Was the swab positive or negative? That's the science, right? I mean, you have to have a positive test. And then ensuring that their death was a result of that respiratory illness. Nothing else happened, meaning they didn't have a gunshot wound or something that certainly wouldn't be COVID related at all.
Great. Again, thank you very much, Beau. Have a very Merry Christmas.
Thank you. You too.